Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Aaron Loney. Aaron had a low back problem, and I'll let him talk to you about that. And we just did regular chiropractic care on him, and he's had great results. So I want to share his story. So why don't you talk about, like what happened to your back, and then, how you felt, and then how you've done during the treatment.
Okay. Well, I've had some minor back problems in the past that have they flared up and gone away pretty quickly. But just a couple months ago, I was getting into the shower and just ducked my head underneath the shower head, and just intense pain across my lower back. It was so bad I couldn't walk, I couldn't bend down, I couldn't sit. I mean, I could be vertical or I could be horizontal, and that was it. It was the only time I got any relief. When I first came in here, I couldn't even lay down on the table. I just had to stand and kind of let them work on me there. But it was just that simple motion of ducking my head that sent it all into the bad place. But underneath Dr. Roadhouse's care, very quickly had a change where I went where I couldn't really walk. I just kind of shuffle along to where I could walk normal. I went to from where I certainly couldn't pick up my children, couldn't play with them very easily, to where now we can interact again, just again a very short amount of time, and it's just been such a huge help compared to just trying to mask the pain with medicine or something like that.
And he's done real well, and it took a while. We used a combination of, physical therapy, electrical stim to help with the spasm, the swelling. Obviously we had a difficult position getting you in any kind of position, so we had to help you on the table to do the adjustment, and we used the drop pieces on you because it utilizes speed. Because there's no way that I could even push, and you would have never relaxed. The pain was so bad. So we did use the drop pieces, which utilizes speed, and then we did the flexion distraction on you, and you started doing better. And then as you progressed, we could get you to move in a position where we adjusted you regular, where you actually heard the popping sound. But by then you had improved quite a bit. So then as we were re-examining Aaron, we found that he had a muscular imbalance. He actually had some atrophy of the muscles on the right that helps hold the lower lumbars and the sacroiliac joint together. So what we want to do is we want to build those muscles back up so that you don't have to worry about if you go and bend, because that shouldn't happen with a healthy back. I've had patients go, well, I bent over to pick up a piece of fuzz. Well, if you had a healthy back and all the muscles were strong, stuff like that wouldn't happen. And a lot of times it's in patients with the same exact presenting symptoms and history like you did. You've had some back pain, got pretty bad, but after a couple of days it kind of went away. And this time it didn't, and it was a lot worse, and it stayed pretty constant. So he's doing great. He's back to doing his regular activities. We still have a little bit of restriction on him on certain things like jogging and any kind of lifting weights where he's bending over, extending or twisting, because we haven't strengthened that side all the way. I mean, I showed you today after we got done treating you how much closer it is right now. So we're just, once we get that done, then we're just fine tuning at this point. Once we get that done, then we'll strengthen the muscles around there, and then you can go and have the confidence that you can do these little things, and it's not going to give you any trouble. But you're doing fantastic. Thanks for being a great patient. And thanks for doing everything, because you were great on doing the eyes. It's a team approach here, and I wish I had 1,000 patients like you.
Thank you.